Mental health is so dependent on how someone feels physically.
Welcome, everyone, to another great episode of Mint Money. We are excited again to have another guest in the TriStar Worldwide Headquarters Studios. Dan Kehres.
Thank you.
Welcome to the podcast.
I'm happy to be here. I'm always excited to be here.
Yeah, well, thanks for coming on. We were just chit-chatting, bantering back and forth. And so I know that you've been involved in chiropractic world, the health world for a long time. And so, why don't you give the listeners and viewers out there too, I would be remiss if I forgot the viewers, a little bit about your background, like a 30-second high-level overview, because I know part football player, part chiropractic, health nutritionist, everything a la carte, all above. So
Absolutely. So long story short, high school, I had a football injury.
Yeah.
Tore all the ligaments in my left leg. I was being recruited by a lot of colleges for football. That whole route changed very quickly. And so I had to look back at myself and see what could I do from a health standpoint to get myself as healthy as possible. So, all the rehab, eating healthy, putting the healthiest foods and supplements into my body to get as healthy as possible to get me back to being able to play football. And I did all the rehab. I got back to being able to play football and went on to play a couple years of football in college as well.
Okay.
And then after that, it led me down a path of health and wellness. I was always very interested in nutrition and movement. And so I ended up going to Elma to study biochemistry. And I was always very interested in how foods either increase or decrease inflammation inside our body.
Okay.
So they either heal us or they hurt us. Okay. And so I learned about that in college. And then I went to Palmer College of Chiropractic, where a couple of my professors had a ton of research in nutrition, and they were doing research on anti-inflammatory nutrition. So I went down there to learn about chiropractic, but also to learn about nutrition, to learn about sleep habits, to learn about supplements and that kind of stuff. And it really just brought together everything from a natural health standpoint, and kind of led me to where I am today.
Seems like there's a lot of talk about a lot of what you're talking about right now, but you were having this conversation, I don't know, a decade or more ago?
In the early 2000s, yeah. And some of this stuff it's crazy because a lot of the stuff that's out today on anti-inflammatory diet, that stuff's been coming on for 20, 30 years.
Yeah.
And so that's kind of where I got in. And I love that I know that from a biochemical standpoint, because you can see through very quickly the stuff that you see in social media that doesn't really make sense, that people are trying to push out there. You can easily navigate through there and get the right answers. Plus, with working with patients, you very quickly realize what works.
Sure. So is that a big part of your business beyond chiropractic, right? I know wellness is a part of the business, but wellness can mean a number of different things.
Right. So another thing that I was always extremely interested in is called epigenetics. Okay. Epigenetics is how lifestyle influences your genes.
Okay.
So everybody's born with a set of genes. Okay. Some people have high-risk genes for cancer. Some people have high-risk genes for diabetes or heart disease.
Right.
Most of those genes are shut off from the time that you're born. As you live your life and you acquire stress, the more stress that you have that you don't deal with, it could be mental stress, physical stress, chemical stress, any stress in our lives, you're more likely to turn those light switches on. So if you don't focus on dealing with that stress and decreasing that stress, you're going to be more likely to have cancer and have heart disease. And so a lot of this was very debated science, but now we know for sure that epigenetics is very powerful. And our lifestyle controls up to 90 to 95% of our overall health.
Wow.
So you can shut off a lot of those genes by reducing the stress in your daily life.
Yeah.
And that's what we teach a lot of our clients or our patients.
Yeah.
That's crazy. And so going back to what you first initially mentioned, Dan, about the food example. Now, just to break it down at a very third grade level, are we talking about eating? I don't mean fast food in a bad way. Fast food can certainly taste good, but is that simply a difference eating highly processed fast food, maybe from one of the big giants, KFC, McDonald's, versus maybe eating some clean chicken or something like that?
Right, absolutely. And so there's a specific difference. And so eating natural foods that are unprocessed are going to be more anti-inflammatory. The things that are going to be the most inflammatory from a food standpoint are going to be the refined oils, vegetable oil, trans fats. It's going to be the refined grains, the highly processed foods, and even some of the grain-fed meats from these protein sources that are on these big factory farms that are eating a lot of grain. So you can literally break that stuff down from a biochemical standpoint, and it will cause swelling inside your body. Okay. And if you go into, when someone walks into a pharmacy, the number one thing that they're walking in there to get is an anti-inflammatory, a non-steroidal anti-inflammatory. Now, why is someone walking into a pharmacy to buy an anti-inflammatory? It's because they feel in pain, right? They feel
Right.
swollen inside. So if they take that and it helps them feel better, that means that through lifestyle and through eating healthier and all this stuff, mental stress, physical stress, chemical stress, you can literally reduce the swelling that's inside your body without taking anti-inflammatories all the time.
Okay. Yeah.
So it basically tells us that most of the United States is very inflamed.
Right. And because we're probably making a lot of bad choices. I mean, we're surrounded by opportunities to make bad choices.
Yeah,
right?
it's called convenience.
Right.
Every single main intersection, you got a pharmacy, you got a couple of fast food restaurants, and then you have a gas station. And if you walk into that gas station, you're not getting any.
Yeah.
It's very hard to get something healthy in a gas station.
Oh, yeah. Absolutely.
Dan, I'm
Yeah.
seeing the burgers in a gas station, 30 grams of protein. Probably not good protein.
So getting more protein and the demand from the public is helping these different companies produce healthier foods. Because if we demanded that McDonald's and all these fast food restaurants only carry health foods and we say we're never eating there again until you have health foods, they would switch in an instant to carry health foods because it's all demand.
Right.
So the same thing's happening when we start demanding. They're putting more protein in these products, which is a great change.
Yeah.
Is the product still healthy? Probably not. And is it healthier just to eat normal, healthy, natural protein? Of course. But the fact that they're starting to do these kind of changes could have, huge impacts down the road.
Yeah. So kind of, I was just joking about this the other day, but when you're traveling though, none of this counts, right? When you're flying or when you're on a road trip, you can it's like all the diet stuff.
It all goes out the door. Yeah.
Right.
So no, I allow for that too. And so we call it the 80-20 rule.
Okay.
80% of the time, if you ate healthy,
Yeah.
then 20% of the time, go out and have your burger and your beer. When you're traveling, enjoy the trip, go out and eat. But I find when people travel, their stress level goes down and they actually, generally, a lot of people will eat healthier when they travel too sometimes. But, you always have to allow for that leverage. The problem is 90% of Americans are eating very, very inflammatory diets.
Right.
Only 10% of our diet of the average American, 10% of the calories of the average American are anti-inflammatory, which is like healthy meats, protein, healthy vegetables, healthy fruits.
Yeah.
And that's it. The rest is highly processed foods.
Right. So is this a lot of what you do then when you meet with a new customer?
It can be. It totally depends on what someone comes into the office with. So for example, this week I had a few people come right from the ER.
Yeah.
Right from the ER. One guy was in there. He was in there for a few days with severe back pain. He's not someone who wants to learn about nutrition.
Right.
Right. So my goal is to get him out of pain, get him feeling better. And then down the road, if he's interested in that, then we will take the next step and talk about that.
Right.
But yes, we do have people that come in that are interested in learning about diet. And I have taught hundreds, if not thousands of classes around the community on nutrition and diet and supplements and sleep, all this kind of stuff. Yeah.
Great. So you have multiple businesses or locations across mid-Michigan, and it looks like now you're also in Southeast Michigan.
Yes.
So what's been it's been a few years that you've been growing your business. How long have you been in business?
2010.
Okay.
Yeah.
Yep. So what's been the most challenging part about growing your business, and what's the most rewarding part of it?
Yeah. So the most challenging part, I would say, is when you're growing so fast, you need to make sure everything's organized along the way. You know, that's one of the biggest challenges, I would say. And so we grew, and then we had to take a step back and just be like, we need to clean up every single process. Okay. This year, like last year, we went through all of our manuals, all of our protocols, everything, our software system, go through and just detail by detail and get everything streamlined. As opposed to if you keep growing, you could definitely find that you're going to get in trouble.
Sure.
When you grow too fast, and that was definitely one of the biggest challenges. Is making sure the protocols were running smooth.
Yep.
So when you go look out new locations, is that simply, okay, I have X, Y, and Z patients coming into practice. Maybe they're coming from 30, 35 miles away, and I can see, hey, we got a lot of people coming from Midland.
Yeah.
Is it, I don't mean to break it down as simple as that, but is that like one of the first things that you'll see is like, hey, Midland could be a great community for us to be in. I think you guys have been here since 2016.
Yes.
Right? Yeah.
Yeah. So absolutely. A little before 2016, I think. I might get in trouble if I say the wrong date. But yeah, I think we were in there about 2014 or so, somewhere in there. Yes, absolutely. So if you have a large clientele and you can open up another location and you can instantly say, hey, we have this location that's 5 miles away from you.
Right.
Go there. And yeah, you can hit the ground running from that point, because if you go and you open an office in the middle of nowhere, you don't know anybody, then you start from scratch.
Right.
So anything that you can do to gain some momentum is going to be extremely valuable. So yeah, we look at tons of different factors. Sometimes we look at more factors. I've had multiple different doctors approach me and say, hey, I'm looking to retire.
Yeah.
Would you be interested in this practice? And I would have another associate doctor who was interested in that location.
Sure.
So then we would, buy that practice and put that doctor in that location.
Sure.
And it was just, a match that worked out really well.
Yeah.
Yeah.
So Clarkston, how long has that office been
Oh,
open?
maybe 4 years now.
Okay.
Yeah.
So what led to that? Was that one of
So
those scenarios?
there's a distribution company that we run throughout Michigan.
Yep.
Mostly with supplements and products that you'd find in a natural health clinic.
Okay.
The doctor there was one of our biggest clients.
Yep.
And he said, hey, I'm looking to retire. He'd been practicing for 40 something years. I'm looking to retire. And we just knew him through that company. He was carrying these products that we were selling.
Yeah.
And so we had a conversation, and that's how that one happened.
Yeah.
That's crazy. That's
I never
crazy.
planned on having more than one practice.
Yeah.
I never went into this, never went into this saying, I want to have 10 practices. I want to have 15 practices. We just kept getting great doctors and great staff.
Sure.
And they were like, hey, I want to come on and I want to join your team. And we're like, let's open another practice.
Yeah.
And then another one would come. And it's just like, it was just, we have such a great staff at all our locations. And that's just what makes it run,
So what led to that? Do you think like what led to these people being excited and enthusiastic?
I don't know. When
about-
I started the pre-chiropractic program at Saginaw Valley back in probably 2012 or 2013. So I started getting tons of interns. I mean, we've had hundreds and hundreds of interns from Saginaw Valley. A lot of them would go on to chiropractic school, and then they say, hey, I'm done with chiropractic school. Can I come back and
Now
work with
what?
you? And so I think our protocols, smooth protocols for getting people up and running, everybody in our team is super helpful. Everybody gets along. It's just it's a great learning environment. And if someone needs help, there's so many people that they can reach out to.
Yeah.
We have lots of different doctors that they can reach out to. And I think that's just a big part of it, why they come on and they wanted to stay with us.
That's great.
So switching from the physical side now over to the mental health side. And so how does your practice, health and chiropractic, how does that all kind of fit into the mental health space? Because I think when people think of, okay, you think of X and Y, I can see mental health maybe fit in the health side more, but can you explain a little further?
Yeah, mental health is so dependent on how someone feels physically. And so think about if you wake up, and I see this scenario all the time. If you have 2 kids and you have 3 kids.
Yep.
So let's say you've got 2 kids, you have 3 kids, what you do. If you wake up and you're in severe pain every day, how do you think your interaction with your kids is going to be, and your wife or your spouse?
It's going to be poor. Right?
It's going to be
so
poor.
good.
It's going to be a little more grumpy, and you don't want to be grumpy to them. If your kids are like, hey, dad, you're going to be a little more grumpy with them. So people who wake up and they don't feel good, maybe back pain, maybe because their diet's inflammatory and they just feel miserable. Maybe they're achy all over, they're fatigued, they're not sleeping. They're going to be grumpy, and that's going to impact their mental health drastically. And so if you want to improve mental health, you can't, sometimes you can say, can you talk yourself into it? And one of the big quotes that I always liked is, what do I want my attitude to be?
Sure.
Do you ever wake up and say, I want to have a crappy attitude today? No, of course, you want to have a great attitude. And so when one person has a negative attitude, it's going to impact everyone around them. And it's like a virus. But you can change someone's attitude by making them feel better.
Sure.
If you sleep for 8 hours at night, if you're eating healthy and you wake up and you just feel like strong and energetic, I guarantee that your mental attitude is going to be better.
Right.
So yes, there's people who have, all sorts of chemical imbalances and that sort of stuff, and they need to seek help from a professional. However, we see it all the time. People come into our office and they're in back pain and they're grumpy.
Yeah.
And one of the biggest things that I love about my practice and being a chiropractor, they come in and sometimes they're so grumpy, and I know this is how it's going to happen. I would be the same way. You get them feeling better after a week or two, and they are bounced. They come in, they swing the door open, and they're like smiling. They're talking to people.
Yeah.
They're having it, like seeing people's lives change like that is amazing. And that's honestly, I get to see that kind of stuff almost every day, which is one of the coolest things, because nobody wants to be in pain. It's miserable to be in chronic pain, and it will ruin your mental health for sure.
Yeah.
Well, I can imagine, too, being able to directly work on people with your hands and being able to go see, hey, I can physically see a change in you, because for so many other people jobs, you might be entering something in a computer, you're not really seeing that direct cause correlation. Hey, look at that direct result. So
Love it. I love it.
Super satisfactory.
Where you can use your hands. You don't need any tools, and it's just one of the best one of the best things. And I think once people get into it and they can use their hands to help people, and the lack of touch in our world. I had a patient come in and this was last week. I never even knew this until last week. So for Medicare, this is my understanding. She said that she can pay, her insurance will cover a regular exam, but if she wants to have a hands-on exam, it's another like $75.
Okay.
Where the doctor will actually touch them and feel, what's going on.
Sure.
So now our medical system is like these people, nobody's ever touching them. If they're 70 years old, maybe their spouse has passed away, their kids don't live around here, they're getting no physical touch,
Yeah,
So
sure.
just when they come in here and we get to work with them hands-on and get them moving better, I think it helps them not physically with mobility, but also mentally.
Yeah,
Like the
sure.
lack
Oh,
of physical
absolutely.
touch, especially since COVID,
Right.
where people just don't interact as much. And that's just a massive thing for health.
Yeah.
Is community and physical touch.
So you've talked a little bit about supplements and biomechanics, things like that. You see a lot of things on social media, like take this, take ashwagandha, take, I don't know, whatever the supplement might be.
Drink
Yes.
some raw milk.
Yeah, right. Are there any shortcuts? And if there are, what would they be? Or is it just just a farce that there's...
No, there's definitely supplements that are great. The
Okay.
first and foremost is I carry supplements in my office,
Okay.
but I talk people out of supplements for the most part to start, because if your diet is not good from the beginning, why
Sure.
waste your money on supplements?
Right.
Don't take the shortcuts to just take supplements. Fix your diet, because that's where you're going to see all the major benefits.
Okay.
So fix your diet first and foremost. Now, after that, I have a few things that I recommend. We live in Michigan and we won't see the sun for 6 months.
Right.
You can easily get your vitamin D levels checked. It's one of the cheapest tests that you could do. Your
Okay.
primary can do it for under your insurance. If not, you can do it online for like $70. Normalize your vitamin D levels.
Okay.
There's so much research on immune regulation and health for just having normal vitamin D3 levels.
Yeah.
In Michigan, I've never seen anyone in the winter with normal vitamin D3 levels without supplementation.
Wow.
It just won't happen.
Okay.
We're inside, we wear long sleeves, we're just
Yeah.
not getting exposed to sunlight. Besides that, the biggest thing that people are depleted from in our diet is magnesium. Okay. Magnesium controls, from a biochemical standpoint, when you're taking classes in biochemistry, magnesium is involved in all the cycles, everything.
Okay.
And so if you're deficient in magnesium, it's going to impact your energy. It's going to impact
Yeah.
your metabolism. It's going to impact your sleep. It's going to cause muscle spasms. So magnesium is the number one thing
Okay.
that people should probably be taking outside of vitamin D3.
Okay.
Omega-3s have a massive amount of research
Okay.
on them, which are good. And then the other one that I like, because people are coming into our office for pain, are anti-inflammatories,
Okay.
but natural. So turmeric,
Okay.
extracts of turmeric, those are going to be the most beneficial for people who are dealing
Okay.
with aches and pains.
Gotcha.
No side effects like NSAIDs, no digestive issues, kidney, liver, that kind of stuff.
Okay.
So they're pretty safe. Outside of that, if someone's going to take other supplements, they should probably start to customize.
Okay.
Is there a lot of misinformation online? Absolutely.
Yeah.
A lot of people are trying to sell supplements to make money,
Sure.
but there are good things. There
Yeah.
are good supplements. And I will say, when I see just one factor of people who might be 80 or 90 years old,
Yeah.
they're almost always 80 or 90 years old and are healthy. Some of the healthier patients, they're almost always taking more supplements than they are medications.
Huh.
So they might only be taking 1 or 2 medications, and
Yeah.
they're taking like 8 supplements.
So how do you figure out how do I figure out what I need? What
Right.
supplements for my body are
So the
needed?
best way is to start slowly and ease into it. Start one thing at a time, because a lot of people, January 1st comes around, New Year's resolution.
Yeah, yeah.
I'm going to take all these different supplements, and you don't know what's doing what.
Sure.
And so I would say just take it slowly. Like, add in a couple things per year. Start with the vitamin D3, start with some magnesium, and just pay attention and go with that for a while.
Yeah.
And then if you're comfortable with that, then maybe add in some omega-3 fish oils. And if you're dealing with something specific, you can talk to a functional health doctor, or you can, talk to other people who've seen benefit with the same issue that you have and
Right.
what they're doing, and try taking what they take,
Yeah.
and do it that way. So it has to be customized. Every
Sure.
single person's metabolism is so different
Yeah.
that you can't just like, here, take this group of supplements.
Exactly.
It just will never work, because
Right.
everyone's diet's different too. So yeah, you have to customize. But I do think most people who are healthy are probably taking 3 or 4 supplements.
Okay.
Yeah.
Yeah.
You think going multivitamins better than the singular route, possibly?
A high quality multivitamin, probably.
Mm-hmm.
that's a whole nother conversation in the supplement world is the quality of the supplements. There's so many different factors that you can look at when it comes to supplement quality. You know, are they certified under this, GMP certified? Are they pharmaceutical grade? And a lot of times they are not, because there's not much regulation in the supplement industry. So you have to do a little bit of research on supplements, and there's thousands of brands out there. There are many good brands of supplements, but sometimes you have to pay for what you get in the supplement industry.
Yep.
Yeah.
And then this is a personal question, but how much of a drop off do you see going from like maybe the pill form to like a gummy form? I can get away from the gummies personally. Like I love the little chewable things.
Yeah.
Especially they taste a little better too. I don't know.
So yeah, there's an issue with gummies and sometimes liquid, because you think about it, when you're making a pill form, so the company that we use, they test every single product. They know exactly what's in them. When you have a big vat of liquid or something that's going to turn into a gummy, you put the supplements in. How do you know where in that liquid it's going to be?
Sure.
So maybe some of that stuff settles down and they're making the liquid pills from the top, and those pills aren't going to have as much, but the ones on the bottom are going to have more. So it's the same thing when it comes to gummies. You don't always know exactly what you're going to get in that because it's harder to regulate. Whereas when it's a powder, you know it's 1 gram or it's 2 grams. You know what you're getting.
I've been basically taking the same form of gummy, but rather kids now, more the adult side, and I get crap for it all the time. Like, it tastes good.
Yeah.
It's a multivitamin. I mean, I see I see vitamin C, I see a bunch of other stuff that, you know, it's probably good for me.
People are definitely more likely to continue taking supplements that taste good.
Yeah.
We have a vitamin D3, a K2D3 that tastes like cinnamon, and people love that one.
Okay.
They will take that one all day over the regular one that you just swallow and you don't taste it.
Yeah.
They love buying that one. Yeah.
So it sounds like supplements are a big part of your business, or a portion of your business.
A portion. I like I said, I encourage people to change their lifestyle in all aspects.
Sure.
And if they're not seeing the results they want, then let's visit some supplementation.
Right. So diet first, it sounds like, from your, then
100%.
Figure out what supplements will work for you.
Yes.
And then beyond that, you mentioned, like, especially for older, healthy folks, you found that they're taking quite a few supplements.
Yes.
What other healthy habits do you see, like, commonly for folks that are, let's say, because quality of life is super important, right? Like 80 is, particularly as we get older. What other habits do you see that people have commonly?
Right. I love this. I love this topic, all about longevity. And so when I have people come in that are 80, 90 years old and they walk in, their posture's upright, they're energetic, I'm always going to, another thing I love about chiropractic is I get to meet with people all day long and ask them questions.
Yeah.
So, you know, a financial advisor comes in, I get to ask them a bunch of questions. A mortgage person, you know, anybody in any field, I get to learn from them. So these people that are 80, 90 years old that are healthy, I love learning from them.
Yeah.
And so, one, for posture, I have found that most people who are 80 or 90 or older who have great posture, they sleep on their back with no pillow. And sometimes the reason is because they had shoulder problems.
Okay.
And they couldn't sleep on one side or the other.
Yeah.
And so they found that they were most comfortable sleeping on their back.
Yeah.
Well, as a default, most people work on computers and end up hunched over.
Yep.
They have perfect posture.
Okay.
But when you have better posture, your lungs are able to expand farther.
Okay.
You're getting more oxygen in and you feel more energetic. So that's definitely one of the big factors. Another big factor is they move.
Okay.
They move. A lot of these people did not have desk jobs. Desk jobs are very, very tough on our bodies.
Yeah.
And they worked until they were a little bit older.
Okay.
Or they had kids when they were older, because they have that sense of responsibility
Sure.
until they, you know, are in their 70s maybe.
Right.
Or I had a guy in just recently. He was 94. He walks in. He's energetic. And I look at him. I go, how long did you work till? He goes, I still work.
Yeah.
10 hours a week. He works at his church.
Yeah.
And so having that sense of purpose is absolutely critical. Having a community around you is critical. They're conscious of their diet, but they're not overly conscious.
Okay.
They will go and they'll have a glass of wine. They'll have a beer. They're social people. So those are just some factors. I mean, there's so many different factors, but you know, sleeping on your back and moving.
So on your back without a pillow, did I hear
on your
you
back
say?
without a pillow if you can.
Wow. Pillows. Let's go around the room. Do you sleep with a pillow?
Yes,
Okay.
but super thin.
Okay.
Super thin.
Gotcha. And yourself?
I sleep on my back without a pillow a lot.
Yeah.
If I roll to my side, I make sure that I have a pillow that is wide enough so my head isn't stuck to the side like this. So a lot of people will have a pillow and they scrunch their neck down.
Yeah.
You have to have a pillow that keeps your spine in line.
Wow.
So yeah,
I think I need to
do
up
have-
my pillow game. because I am not.
Even you don't have to do it all night either.
Yeah.
Sleeping on your back, they don't sleep on their back necessarily all night, but they will fall asleep on their back and they'll stay in that position for an hour or two.
Yeah. So the problem is that if I fall asleep on my back, I think I snore. And
That
then
is a problem.
Then my
Yeah.
wife is waking me up. Or
There's many different things you can try for that, but yes, that's a challenge.
Yeah.
You have to be able to sleep on your back, make sure you're still getting a good oxygen in as well.
Yeah.
Because that's a separate issue. Yeah.
Yeah.
And so, from your experience, just out of curiosity too, do you see more people come in from more of a blue collar construction background in regards to getting chiropractic work done, or more from the office side? Because I could really see the duality. Because obviously, like, just think about, let's go pick on construction. You're going out, you're physically moving your body around. That could be a good, but it could be a bad thing. And for the office, exactly what you're saying. Hey,
Right.
you're stationary all day, but maybe if you're hunched over, maybe you're not getting up and moving. Because I gotta be honest, Dan. I mean, I see my total step count some days, Monday through Friday. It's low.
Yes.
It's very low versus the weekend.
Yeah, I love this question too. So this probably will shock a lot of people, but sitting at a desk. I do x-rays all the time.
Mm-hmm.
If you sit at a desk for 30, 40 plus hours a week, your L5, the disc in your low back, that joint, 90% of the time is going to become a major issue.
Wow.
So when I see people who move the best, construction, farmers, painters, these blue collar people, they're on their feet. Yeah, and so sometimes they have orthopedic issues with their hips and that kind of stuff. But I get farmers in all the time. I have a couple right now, 80 plus years old. They can hop on the table. They can get off that table. They're strong. They're mobile. They move good.
Yeah.
I see people all the time that sit at a desk for 40 hours a week, and it will destroy your low back.
Wow.
And so you have to find ways to move throughout the day.
Yeah.
Setting an alarm for every hour, using a standing desk. At home, we have a treadmill, and for $100, we bought this plexiglass desk that just sets on top of the treadmill. And so my wife will just walk slowly at 1 or 1.5 mile an hour, and she'll work for an hour or two.
Yeah.
And that's canceling out that sitting. And so you have to be very, very conscious about sitting. Like, this conversation is about the most that I'll sit. When I drive and I'm here, this is like the most that I sit.
Yeah.
And honestly, the more that I work with people that have desk jobs, the more it makes me never want to sit.
Yeah.
Because of the problems it causes.
So you're concerning me right now. So let's just say,
I should
for
be,
instance,
I'm serious. It's a serious issue.
Yeah, and it really does, because I feel fine today and now, but I just turned 50 years old,
Right.
and I want to we talked about longevity and feeling good. So let's say I got this iWatch for Christmas. It's bugging me every hour to get up. What should I be doing, and how long should I be doing it every hour?
Anything. Because most people, they just get sucked into their job. The worst are engineers, dentists, hygienists, people who are sitting and they're focused.
Yeah.
Those are the worst.
Okay.
So anything, just getting up and moving your back, because what happens is when we're sitting at this angle, the disc in your back will start to change shape.
Okay.
Ooh.
And eventually, when you stand up, that's where you see people walking at the store. They lean forward because it makes them feel better.
Okay.
Because it's taking pressure off that disc. Well, that's going to lead to a nerve issue, which ends up leading to injections or surgery.
Right.
Happens a lot. So
Goodness.
as far as getting up and moving, do the opposite of sitting. Lean back, do some extensions. When you're sitting in a chair, get your arms back behind you, look up, stretch out everything in here so you're not leaning forward in this position. That's going to be definitely one of the best things that you could do. Anything is better than sitting.
Right.
Anything.
I'd bring like a treadmill in the office or something too.
Yeah, well, I know
doing some walking.
Shelby in the Midland office.
Oh,
she's got a treadmill in her office. Yeah, maybe I need to follow suit and
My
get one
goodness.
myself. Yeah.
Yeah.
Yeah, because there's just so much research on what you're talking about, steps, the step counter. There is so much research on steps in health. I mean, your risk of cardiovascular disease, your risk of cancer, your risk of diabetes.
Well, and you feel so
just by
better.
moving.
You feel so much better too going for a nice walk too. Like I can imagine on the weekends, like this last weekend, I think I looked at my phone, end of day, 18,000 steps. I felt great.
Yes.
A lot of time playing outside, a lot of time going for a walk with the kids too, and just felt great
Right.
afterwards. Now, suspiciously fed another ice cream when I probably shouldn't have, but I felt
That's
great.
right. Yeah.
Yeah.
No, that's it.
Yeah.
It's all about movement.
Yeah.
So Dan, I do have to throw you a curveball question. Not that saying this is tough or anything, but at the end of every Mint Money podcast, let's go chat about what we've been watching lately, streaming,
Yeah.
TV, anything underneath the umbrella. So what have you been watching lately, if you don't mind?
That's interesting.
Just
So my
asking.
wife and I, we have 4 kids. We got our businesses, so we don't usually watch much TV. We prioritize sleep.
Yeah.
But the show that we put on we probably watch a couple episodes because when we watch a TV show, it might take us 3 nights because we'll watch 15 minutes, like literally we'll watch like 15, 20 minutes at a time just to decompress. We started watching Pitt. It's a medical show.
Yeah.
Oh, really?
It's basically
Yeah.
like 24. I think it's like they're on shift for 18 hours, or 15 hours, and each episode is an hour. Okay. And the biggest takeaway from this is that you do not want to end up at the hospital.
Yeah.
Because it's chaos. I mean, it's chaos. When you get in there, these people they're waiting for 4, 5, 6, 7, 8 hours.
Yeah.
And when I watch these types of shows, I'm always thinking about how much of this stuff is going to be lifestyle related. How much of this stuff could you prevent from ending up in this situation? Because when you get in the hospital, our medical system in the United States is the most phenomenal in the world when it comes to trauma care.
All right.
When it comes to trauma care, if you need to have surgery, if you break your leg, our medical system is phenomenal. When it comes to chronic issues, like diabetes and heart disease and I call them all the itises, because anything that ends in itis means inflammation of the body, like cystitis, pancreatitis, diverticulitis.
Yeah.
That just means inflammation of the body. You don't want to end up in our medical system with those issues.
Okay.
Because you're going to be a ping pong ball. And you're going to end up in and out of the hospital, and you're going to be spending a lot of your money and a lot of your time wasted on this kind of stuff as opposed to enjoying your life.
Yeah.
You know, to that point, I read a book that I think that was published maybe 2016, 2017 called The Hospital. Does that ring a bell at all?
I've never
to you?
read that one.
And so it's about a single, I think, well, hopefully at this point it has been bought out, but it's about a single hospital system down in the central part of Ohio. And it really talks about, because I think the overall hospital might be 50, I could be grossly understating this, but 50 or 60 beds, but it really ties in, like it revolves around 2 or 3 people that will go through a couple of encumbrances, whether this person has chronic pain issue, this person now has to go from this system, that system. But I really never knew really how integrated everything was, because this little town's only like 10,000 people, if that. And so be able to go see the whole integration of the town, how interconnected really everything is just with public health.
Yeah.
Things going on in the hospital, it's nuts. Really
It is. And I think the biggest thing that I've realized when it comes to our medical system and chiropractic and physical therapy is our medical system is way less complex than we think it is. So if you have an issue, you try to fix it yourself.
Yeah.
Right? Everybody tries to fix themselves. They might YouTube a video for stretching or they try supplements or whatever. If that doesn't work, they reach out to someone like me or a physical therapist.
Right.
Someone that's doing something natural, acupuncture or massage.
Right.
If that's not working, you're running out of options.
Right.
Because when you get to your primary doctor, what are you going to get?
Probably a pharmaceutical.
Drugs?
Yeah.
If that's not working, what do you get? You get injections, you get surgery.
Right.
And so most people, they just think that there's more medical options when there really is not. You know, the future of medicine hopefully is promising with some of these like stem cells and all these different modalities that they're working on. But you have a lot of control over your health.
Yeah.
And people need to understand that they need to do as much as they possibly can before they end up in that medical system.
Yeah.
Sure.
I mean, that's where we come in. That's where physical therapy, anybody doing anything natural, all these functional medicine doctors.
Yeah.
I love all that because try it all. People will say, well, what do you think about this? And I'm like, look, if you're on the path to having surgery, try everything.
Yeah. Right.
What do you think about this little neck traction device off Amazon? Try it. What do you think about an inversion table? Try it. Try it all. Why? What do you have to lose?
Yeah.
You know, because it's if you spend $100 on that, once you get in the medical system, you're not spending $100 on anything.
Yeah. Right.
I mean, we're talking thousands and thousands of dollars for anything. So try it all. Try everything natural that you can think of.
Yeah.
It's crazy.
So I'm sold. I'm gonna call you guys. I'm gonna schedule an. I really am. I'm not just saying that because you're on the show.
Yeah.
But what else would you want our listeners or viewers to know about your business or about what you do?
Yeah, I mean, we are always just looking at total health.
Okay.
And so something we touched on a little bit, but is the longevity, right?
Yeah.
So when it comes to longevity, there's 2 different ways to look at it. You want to live your longest, healthiest life, right? You want to be 90, 100 years old, as healthy as possible, traveling the world until the last day.
Right.
That's the kind of life that you want to live. There's 2 different ways that you can analyze life. There's chronological age, which means the day you're born until the day you die, which the average American and females around 80, 81. The average male American dies around average 76 years old.
Oh.
Okay, that's chronological age.
Yeah.
There's the biological age, which you can now, there's tests like Function Health.
Right.
It's a test you pay for, and it'll analyze all your parameters, and it'll give you a biological age. It'll tell you how you're aging in conjunction with all your peers.
Okay.
Okay? Most people, their health span is only to like 50 or 60 years old. So their chronological age lifespan is about 80 years old, but their health span is only around 60 years old.
Right.
Because that's when they hit the wall and they're seeing all these medical doctors. They're having all these health issues.
Yeah.
Okay. So you want to have the absolute longest health span that matches your lifespan.
Yeah.
So you want to be healthy to the last day.
Absolutely.
And only about 10% of the population is doing that right now.
Wow.
Most people are getting sick in their 50s, 60s, and it's scary. And so, our goal is just to help people, live the longest life they can as healthy as possible.
Yeah.
And it's so sad for me to be able to walk around and see people who are ruining their lives through their lifestyle.
Sure.
And it's so devastating for their family. It's so devastating for their friends and how it impacts people. And so anybody who can make one small change,
Yeah.
one little change that they can change throughout the day that improves their life, that makes it worth everything that we do, you know? And for us, chiropractic, obviously getting someone moving, that's super critical.
Sure.
That's only one avenue. There's
Right.
so many avenues when it comes to health.
Yeah.
Great. Well, perfect. And so if people do want to go in contact with you, of course, website, phone number, Facebook, LinkedIn, what would be the best way to get in contact if
All the
people have
above.
questions?
Yeah. We do stuff on Facebook, Instagram, our website. If you send an email there, it most likely goes directly to me. So I'm involved with all that stuff. So yeah.
Okay. Good.
Well, perfect. Well, thank you so much for coming on. This
Thank you. I appreciate it.
Very, very eye-opening, and I'm going to be taking a look at my own stuff. So
Yeah.
Sounds awesome. Sounds awesome. We
Yeah.
appreciate you having me.
All right. Thanks for coming.
And thank you everyone again for listening, watching another great episode of Mid Money. Until next time, thanks.